wanted to welcome you. Is it the first time doing Zoom for any of you? Yes? Ricarda, is your first time?
Yeah, it's the first time I'm joining.
Oh, yeah. Do you want to introduce yourself a little bit?
Sure. Yeah, my name is Ricarda. I joined. I found out about this the whole annual membership through a fellow doula. So I've been I did the doula training last year, and I've been working for the last couple of months, and found out through a friend who has done a midwife apprenticeship in South America. I think it was in Peru. So yeah, she pointed me in this direction. I'm super grateful for the resource. Thank you.
What is your nationality?
I'm German.
You're German. Great. Yeah. Okay. Well, you're very welcome. I'm very glad you're here. And Amina, is this your first Zoom, or we've seen each other before? I don't remember if we did see each other. But at any rate, if anybody who's joining us for the first time would like to introduce yourselves, feel free to do so. Okay. And I would like to open up the mic. Hello, Heather. Hello. Hi. Is this your first time doing the Zoom, Heather?
Yes, I watched the recordings before on the others, but this is the first time I'm joining live.
Great. Well, you're very welcome to join us. Would you like to just tell us a little bit what country you're from and what it is that you do, so we can get to know each other a little bit?
Sure. I'm in the United States. I practice in Utah. I've only been practicing for a couple years, and I took this last year off to cook my own baby and deal with some health stuff. But but I'm back again and assisting and taking my own clients again as well.
As a midwife?
The midwife, yes.
Midwife. Wow, I did see a belly there. How many months are you?
Well, I just had him. He's 5 months old now. So
really? So it's the post-baby belly. That's good.
Yes, it's a beautiful post-baby belly, and I love it.
Yes. Tell us, was your baby born at home?
Yes. Yes.
Oh, wow. And was it with a midwife assisting, or was it a self-assisted birth?
It was with a midwife, sort of. She's actually my best friend that I work with. So, and while she was there, I caught my own baby, and it was essentially unassisted, and she just sat and supported me. And fortunately, her and the other assistant she brought squeezed my hips like the Dickens, and it was fantastic. That's all I needed was a good hip squeeze.
Oh, fantastic, Heather. Well, nice to meet you. And who else would like to introduce? Vanya, would you like to introduce yourself?
Yes, I can. So I'm from Portugal, and I'm a nurse, and I work as a nurse. I'm also a doula, and I'm studying now to become a midwife.
Okay, fantastic. And Michelle, would you like to introduce yourself just a little bit for us to see who you are?
Sure.
Yeah.
Hi, I'm Michelle. I'm originally from California, but now I live in Berlin, Germany. Actually with Ricarda, who's here also.
Oh.
And yes, I guess maybe the most exciting thing on my plate right now is hoping to start a doula collective with the doulas here and make more community. Yeah.
Good. Well, fantastic. You're so welcome to be in this workshop. It's really nice to see all these new faces and to feel, just the movement that is taking place in the pandemic around the world, and that everybody's really working. Nobody's really stopped, I don't think, except for who is stopping to have a baby. And so, but as far as I have met the different people from around the world, people are working even more, and that is a very, very fascinating just phenomena of this pandemic, because of women, of course, don't stop having babies, and some are even getting more babies because of staying at home, and being together and having a lot more time perhaps to be making babies. So the midwives that I know and that have been reporting their work seem to have a lot more work in their hands, a lot more home birth happening as well. Amina, you're driving, but do you think you can tell us who
Yes,
you
I
are?
apologize. I apologize. I'm driving. My older daughter is on the ballet, and my younger daughter is behind. So if you
Okay.
hear anything, yes.
Yes, we can hear. Okay, so after you drop them off and you get a chance to tell us a little bit about you, it'll be fantastic whenever you want. Okay, great.
Okay.
I would like to give you the microphone and just welcome any questions or any comments or reflections on the videos, the topics that we've been covering lately. It doesn't matter if it's from the earlier videos, but I would like to just ask you how it is that you're doing. What reflections have you been having from the topics? If anybody would like to start.
I wouldn't mind starting out. And I'll start with this month's because I made sure I watched these before today. I still have a few to catch up on, but I was really fascinated by how gentle you are with the babies during the newborn exam. I thought we were gentle, but in comparison, especially when checking for Moro reflex, I was trained where you just kind of let the baby fall a little bit. And we thought, well, we only let them fall an inch, so it's not that far, right? But they sure don't. And so I loved how you showed how to do that in a much gentler way. And I actually used that yesterday, checking on a baby that was born, I don't even know what day it is. It's Tuesday, born early Monday morning. So got to do that just recently. It's lovely.
Thank you. I'm currently working on the second half, which is, I realize that I start out with every topic thinking that it'll be doable in a half an hour video or 40 minutes, but it's impossible. There's so many details that I would like to include, and I'm leaving a lot of details because, we can talk about them in the Zoom, and I'll be next year being able to put the PDFs together with videos just to expand and go more in depth. But there's a lot of details, mostly not so much of perhaps the clinical, but what is behind, what the feelings about it are, and the reflections and the connections between what we're doing with life and with existence. There's so much that goes with every single detail. But that's actually one of the ways that we can explore during the Zoom. And yesterday I was reflecting a little bit with some of the Portuguese and Spanish Zooms on how important it is to put oneself into the baby's, no shoes because they have no shoes, but in their baby's skin, and to look into their eyes and see and feel what they might be feeling. And that is an exercise that I think will always prove fantastic as midwives or doulas to try and feel what the woman is feeling in labor. And if she's afraid, you can see in the eyes when somebody's afraid, when somebody's sure of themselves, when somebody is just seeking for something, when somebody's uncomfortable. We can really feel the other person. And to be able to do that with the babies, it's just really, it's something I love to do because they're so pure. You can really somehow get to feel the realm of their purity. And it's just beautiful. It's beautiful. And it's something you can't really say in those videos unless it was a much longer video, right? That would explore the different levels, because every time we work as a midwife in any realm of the profession, we explore different levels. It is the clinical level, the anatomical level, the physiological, the energetic, the emotional, the psychological, the union between us and them, the intangible one, the one that has to do with the ancestry of the woman, with the baggage of perhaps fear and stress and memories that are hidden. There's so many levels that we can explore that it's really not quite possible to put them all on a video that aims to do evaluation of the newborn, or maybe getting the baby to engage or stimulate labor, but it's definitely what makes up the art of the midwife, the art of accompanying birth. It's all those layers together, and acquiring and developing the sensibility to tap, into those different levels. Do you want to talk about that a little bit? I'd
I
love
actually have a question.
Yeah.
I actually have a question too that I thought about as you were talking. And it's about this birth that we just had too. This baby was born just a little bit asynclitic, just a little bit. And so it made for a long pushing stage for the mom, and we actually gave the baby, sorry, my daughter's playing a game in the background. If you hear chiming noises. When the baby was born, his APGARs were about 6, and we were prepared with a bag and mask. We gave him 5 inflation breaths, and he perked up right away. Was breathing really well. About an hour postpartum, he started showing signs of respiratory distress. We were seeing some grunting. His respirations were 98, and sorry, sun coming in the background too. And we started seeing some retractions, and I'm doing this from memory with not very much sleep. So we saw all the signs of respiratory distress, and then he developed a fever as well, just a very mild one. And so we made the decision to take him to the hospital, but by the time he arrived, he was doing much better, and they gave him 20 minutes of positive pressure ventilation and sent him home. So my question for you is, how does that resolve so easily? Is there something I don't understand the physiology of how that could resolve so easily? Because we could have done the positive pressure ventilation at home.
Yeah, you could have. I think it's not so much about being able to resolve it or not. I think you probably were thinking it could be an infection, right? It could be something that could get like dramatically worse in a short period of time. So I think you taking the baby to the hospital was really quite correct. And the hospital overviewing the whole panorama of the baby and seeing the baby was fine. Did they run any blood tests on the baby?
No.
Quite interesting. They sent the baby home. They felt assured that the baby had no infection.
Yes, yeah. The fever had resolved too, which I don't understand the physiology of that, I suppose. Yeah. I feel like the choice to take him for sure, even if it resolved so quickly. I feel like that was the right choice, but
yeah,
I just don't understand how a fever resolves so quickly. I was expecting he would need antibiotics and,
lots of help. There's something that is always interesting when there's a fever is to make sure the baby's hydrated. So my question is, did the baby nurse before developing these symptoms?
Well, that was one of our signs that he needed to go, was he was grunting and he would latch on, but he never got a very good nursing published.
So that was after an hour of having been born. So
yep.
within from the moment of being born till the grunting, there was no nursing established at all.
There were many attempts. He was trying that whole time, because as soon as he was born, we brought the mother to the couch and got her comfortable and tried to latch the baby on, and he would latch on and then come off and and he was struggling. And so we continued to try as we were cleaning up and helping situate the mother as well. And then about an hour, we noticed that he had started grunting and thought, okay, there's something more than just having trouble.
Was the baby by chance quite big?
Oh, yes. The baby was over 9 pounds.
Yeah, because sometimes a baby that's quite large and makes efforts at nursing, like, it's working and it's not managing, the sugar level might go down. And when
that makes sense to me. He did get a little bit jittery somewhere around 45 minutes. And I just noticed it. I don't think we even wrote it down. I just noticed he did it once. I thought,
Yeah, so it's possible that the glucose level in the baby's blood went down and started, getting out of equilibrium. I forgot the word. Just like losing its stability, organic stability. And so the homeostasis of that, what's that?
The homeostasis.
Yeah. And it's just the equilibrium of everything inside the homeostasis. And then I think that would possibly produce those symptoms. And the interesting thing is the glucose level, how did it come back to normal? They didn't give the baby anything in the hospital, did they? Glucose?
So they didn't let us in. I don't think they gave him anything. They gave the mom stuff, which was annoying. She wasn't there for her, but
Yeah.
but didn't give the baby anything.
Well, yeah. I think that I can imagine, Heather, that perhaps if the baby had managed to nurse in that period, that wouldn't happen. And perhaps if one tries to learn something, maybe next time give it maybe a little bit of sugar water with a spoon, just to, yeah, yeah.
And I think it's also possible. So during the drive, we chose to transport the baby skin to skin with the mother, and so he got lots of skin to skin. And I believe she was attempting to nurse that whole time, so she may have gotten something in him during the drive.
Right.
I wasn't in that vehicle. I was in another but
yeah, great. Well, I'm glad the baby's doing well. And after coming back home, the baby nursed quite soon.
Yes, yep. The baby nurse is nursing very well now.
Yeah.
Well, sort of well. We worked a little bit. He has a little bit of oral defensiveness. I asked the mother if they put any tubes down him, and she said no. But I wonder if we just were a little more aggressive than we need. Well, probably not than we needed to be. He needed some help when he was born, but we did, aggressively wipe his face and stimulate him really well when he was born, because he was white and floppy.
Yeah.
So I feel like we did the right things, but he is nursing well, but we're doing some suck training to help him. Sometimes he likes to bite down on her and have a little bit of oral defensiveness, but he is nursing now.
Yeah. Yeah. You know what you might try to give the baby just a little globule of two of homeopathy called sepia. I've seen that work really well for babies who have that defensiveness.
Thank you for that.
Yeah. It really sort of melts that away, and they just, they take on the breast really well. I've used it a few times, and it's quite amazing, quite amazing. Yeah. The sepia homeopathically is a remedy that's really good for people who have a rejection to the people that are closest to them. It's very interesting. It's also called the like an embittered widow syndrome, like when you're like sort of barking at people and having this emotional rejection towards people. So it works really well for women who gave birth and they're not really connected to the baby. You've seen those women who are like kind of, sometimes they even look away from the baby and they just sort of let the cloth fall on the baby. They seem clumsy and disconnected. You can give them a woman sepia and she will come back to the connection. Same thing with the baby. Okay.
Can you please write it down in the chat, Naoli? Can you please write down the name in the chat, please?
I will write it down. Okay. Sepia, and I would give it at a potency of 30C, diluted in water. 1 spoonful. If it's a baby, I would give it every 10 minutes. If it's adult, every 15 minutes. Okay? 10 minutes for baby. Even sometimes 5 minutes, because a baby is just very receptive. So sometimes if it's a critical situation, you do every 5 to 10 minutes on a baby. And minutes on a baby. There we go. Okay? The sepia remedy. I'm going to make a video on the most important remedies that I use for birth-related situations. It won't be a comprehensive video on all homeopathy, but at least 5 or 6 remedies that are just amazing. I will do that. So I can't promise when, because I've got the Reboso videos coming up. But in the meantime, I'll giving you tips about this and that, homeopathy-wise. Okay, so what else? Somebody else would like to share a reflection or a question? This is a beautiful.
I have a curiosity.
Sorry, I was just looking at Heather's son. Very cute. Hi. Okay, Vanya, go ahead.
So I was curious because when you've done your assessment on the newborn, you were measuring the nipples. So I was curious because I've never heard of it or seen or.
I know, I know. It's going to be matching with the part 2 of the video, which
Okay.
is has to do with gestational age. It's one way of knowing how thick the cartilage, how thick the little mammary gland it is. But I know if it's only by itself, it's kind of but it will tell you a baby that is predates or a little premature will have a smaller areola, and a baby that's more mature will be thicker. So it's mostly that. Yeah. If you look at it, truly, a lot of these things, you don't really need to do them. You can just look at a baby. You can just, at a glance, know if a baby has, a little bit drier skin, if the ear is a little bit thicker. There's a lot of things that I don't do perhaps to everybody because, you don't need them. But if you want to be thorough, if you want to be very clinical, very correct, that's the whole thing you would do. I'm sure there's perhaps other things that some people do that I don't do, but measuring the nipple is part of the assessment of gestational age.
The thing about being so thorough is I found it quite interesting to do with the parents as well, just so they can know their newborn, like be acquainted to him.
Yes. I always find that they just love it. It's like what I see in their eyes is like they're opening a present, like, on Christmas Day, like, wow, what is this? They've been waiting for the baby for so long, and all of a sudden you get to see all the parts and how they fit together and how they respond. And I was noticing when I started working as a team midwife here in Florianopolis, Brazil, with my colleagues, that some of them are nurse midwives, and none of them did the newborn exam as almost like a ritual. They just sort of like, the woman was in the shower and they'd be like checking quickly, and then when the woman came back, they'd say, oh, the baby's great. And I always was kind of shocked and amazed because even weighing the baby, I don't do it if the woman's doing something else, because I know that she'd love to be part of it and see it and like just witness the whole process. So, my colleagues have been sort of, adopting their ritual of doing it together with the parents. And the other thing is that I noticed that they've changed is to not do it on the day of the birth, because usually the woman is still in her voyage, in her trip of the birth. Many times they're either tired or they can't get any more in their neocortex because they're still in the instinctual part of their experience. So I'll do the basics just to know that, yeah, baby's good. But then the next day, they're usually quite ready to uncover and to understand concepts. And it just goes in a different channel of the brain, the understanding, even the openness to know. I've seen, early on my colleagues doing it on the day of the birth, and the woman is kind of like, it's like there's no space inside for it. So it's just observations of mine, because I know that perhaps a lot of professionals are quite busy. Sometimes the birth is exhausting and people are just wanting to get home because everybody's a little tired, and sometimes professionals don't come back the next day. I don't know how you do it, Heather, about coming back the next day or only a few days later. But for people who don't come back the next day, of course, they want to get it done that same day, right? So they don't have to come back. I usually come back the next day, which is the first day after birth, third day after birth, to just to see the breast and to see how the baby's nursing and if there is anything on the perineum and if she went to the bathroom, the whole assessment of the bleeding. And it's 1 day, 3 day, 1 week, 2 weeks, and 30 to 40 days. So I usually do 5 postnatal visits at home, but not everybody does. Not everybody, perhaps has the time to do that. So going back to you, Heather, how do you do it? What is your?
That's exactly how we do it. This one was a little different because we did take her to the hospital and they wouldn't let us in, and we hadn't done a full newborn exam yet, and we hadn't done. We ended up. This is the part that really hurts my heart, is because we knew that this baby could go bad very quickly. We didn't suture the mom yet either, and so we took her in there and we told the the OB department that she needed that done. And it was unfortunately a doctor that we don't work well with. And he was not very kind to her at first. He did better after she gave him a stern talking to. but I've also seen him suture, and I know that we do a better job. Anyway, so I went back later that same day, when they were home to check on everything. But normally it's, we come back up 24 hours and then we come back at 3 days, and just the same schedule you said. We do have one more visit at 6 weeks. We used to not, and then we just found that people needed it in our area.
Yeah. So you would do 1 day, 3 day, 1 week, 2 week, 30 days and 40 days?
Yes.
Okay. Yeah. Yeah. And some women need a lot more than that. And other women, you call them on the phone on the third day and they're like, I'm great. We're doing well. We're just eating and sleeping and there is no worries. And if they don't have any worries, then we just maybe not go if it doesn't matter to her, right? So it's adapting to people. So how about going back to what I was saying about the ability to feel what the other person is feeling? I think that's a beautiful topic to explore, really.
I know I've talked a lot so far, but but I really felt this a lot with this baby, and I felt it with some others as well, because of the way he came, and even as he came out, his head came out, and we waited for restitution, and then he got one shoulder out, and then he just did this himself, and then he got one arm out, and then the other shoulder. It was just so slow, and today when I was checking him over, I could see that his shoulder was really hurting him, and so I had to be extra gentle, and even as I handed the baby back to mom, I was like, oh, my shoulder hurts just thinking about him feeling what he was feeling. And I told her how to, try to support that. And I suggested she take him to a chiropractor as well and give him some arnica. And
do you think the baby's clavicle might have fractured?
I did check that. I didn't feel a fracture, but I did check. Yeah.
I guess if it's a hairline fracture, you wouldn't feel it with your fingers. And
That's true. That's true.
Yeah,
that's
it's
true. I kind of think he had some swelling. He had some swelling on one side in his back.
Yeah.
It could have been any of these things.
Yeah, could have been. There's something really interesting I just thought of that happened to me before we left Mexico to come to Brazil 9 years ago. My kids, who were teenagers at the time, there were a lot of young people coming over to the house to say goodbye and just to, to see them. And I remember coming home once with my groceries, and I went into the house and there was this young man sitting on the couch by himself, very polite, just sort of sitting there. And I said, oh, hello, good morning or good afternoon. Are you, because I didn't know him, are you here to see Ty? And he said, yeah. I said, oh, well, feel at home, he should be arriving in a minute. And I picked up my groceries. I turned around to go to the kitchen and I froze. I just I can't even explain what it is I felt, but I just stopped in my tracks. I let the groceries down on the floor. I turned around. I looked at this 20-year-old man, looked at him in the eyes, and out of my soul came the words, are you Tomas? And he just had tears rolling down. He said, this was a boy that I had received when he was born, that I had not seen since he was 40 days old, because his mother, she was a musician at the symphonic orchestra, but she wasn't a friend of mine. So we didn't see each other at all ever since then. What was there between him and I that, because he knew I was the midwife, but he was too shy. He wouldn't come out and tell me, oh, you caught me. What was it in just that little moment of seeing him sitting on the couch that made me turn around and recognize him and remember his name? Because it just it didn't come from my brain. I know that. It came from my soul. And that experience to me was just so significant. It really talks to me about the connection that we have with a baby. It's a soul connection, and it wasn't even a baby I needed to resuscitate or reanimate. It wasn't, the mother actually had a bleed that was pretty dramatic, and, we solved that. But, the baby was fine. It wasn't like, oh my God, because I gave him breaths, I recognize him. It was just one more little baby, except that it was ingrained in the soul of our connection. So that to me, and other, situations, that really speaks to me about how we connect with the baby from the womb, during the birth, with our care, with our sensitivity, with the respect that, it's just looking at this human being, feeling the human being. And something about that gets ingrained in our soul, even if we don't recognize it in our minds. And I can imagine it would be ingrained if it was violent as well, Quite interesting, quite beautiful. That's
Naoli?
Michelle?
Hi. You're breaking up a tiny bit. I don't know if others are experiencing this as well, but I think
Okay.
I and probably all of us caught most of that beautiful story. And I have sort of a burning question, need right now, sort of talking about this connection with the baby and this soul connection that we make, even as, not as the mothers, but as, someone who's with the baby, caring for the baby. I have this, I've been working with this family for just 2 weeks now. The baby was already 3 weeks old when I started working with them postpartum. And the mom has very, very severe postpartum depression and had trauma after, right after the birth, and is, from what I can tell, I work at night, so I actually don't see her a ton, but every time I come, she's like locked away in the bedroom. She's taking, sleeping pills, and she's on different medication like SSRIs for her depression right now, and she's not breastfeeding, and the dad is with the baby all the time. And so I'm sort of there. I come in at night and I just, relieve him because he's with the baby all the time and he needs sleep. And I'm wondering how, like, what your experience and maybe others working with families where it's very obvious that this connection, the baby and the mom are just not having this connection. They complain, the dad will say, oh, he's just been crying all day, or crying all night, like he has, we think maybe he has night terrors. And like, I mean, I don't quite know exactly what night terrors are, but every time I'm with him, he's just totally sweet, like he's, I don't know. And I just don't know how to facilitate like more of a connection. I don't know. I'm kind of at a loss of how to support them connect more with their baby.
First of all, do you know what kind of trauma the woman had after the birth? You mentioned she had some trauma. What was it?
Yeah, she, so again, this is the story coming from the father's perspective, because I really haven't connected with the mom. But he said that the birth, they had the baby in a clinic, and he said that the labor and the birth itself were pretty well supported. But then postpartum, she ended up having a hematoma, I think in the vaginal walls, which I don't think was realized for a while, and she was like bleeding a lot, and they weren't very well supported in the postpartum, and just
So that was traumatic for her. And did she already have depression before the birth? It's a tendency of hers. Yeah.
She was on antidepressant meds for I think like 15 years before getting pregnant, and then was off of them while pregnant, and then is now back on them.
Yeah. Well, what I can think of is giving sepia to her, which is, in some way it's going to be treating her rejection towards the baby, because sometimes women who have I mean, her story is more complex, but women who have some sort of trauma during the birth, they tend to somehow resent the baby for it as well. You know, sometimes when the pregnancy brings hardship to the woman and the birth as well, the baby is kind of like the cause of it, and there's a direct rejection. I think sepia would do really well. I think depending on what she had to resolve the hematoma, perhaps they cut it open, because usually a hematoma, you may have to just cut with oh, the words in English. Anyway, cut it open and get the clot out. So sometimes that could be a little traumatic. And there's another homeopathy I can put here, Staphysagria, which can be really good also for healing emotional and physical trauma, which is like a knife cut, you know, like a sharp cut. And I think the baby could definitely use a homeopathy. There is one which is fantastic called Ignatia for loss, for when you are losing something precious to you, which could be a loved one, could be a woman who lost a baby, any kind of deep loss. Ignatia will go in and help with the dwelling of it, or the mourning of it. So I think a combination of homeopathy could be really good. And the baby would go with Ignatia. And I think that aside from that, I would imagine that the baby would probably stop having all those crying fits if somebody could just wear the baby a lot, just wear the baby.
Yeah,
Right?
I mean, the dad does most
The dad does.
most of the day. Yeah, he's wearing him.
Yeah, the father might also be able to use a little help. The rescue from the Bach flower remedies could be really good also for the three of them. You know, the baby can wear it, you know, get it put on the fontanelle, a few drops of rescue remedy on the fontanelle, and the mother and the father can just, you know, do it orally, because it's been traumatic. How old is the baby now?
I think he's 5 weeks. Yeah, I think.
Yeah. I think those three remedies could go a long way. The woman could use sepia and Staphysagria both, and she could take alternating it every 2 hours. She could take one, 20 minutes later the other, and then again 2 hours later one, 20 minutes later the other. I don't know if she's going to have a condition to be remembering that, but at least if she can at least take 3 times a day, one and the other, alternating, would be good. Is she somebody that is a sweet person, like she wants help, she wants to get out of this, or is she more hostile?
Yeah, I think she was telling me that, you know, she's having ups and downs, and when she has the ups, she wants to like stop taking her meds, which is, I think, a common mental illness thing. Like once you feel better, you're like, I don't need this, but then, you know, she sinks back down, and when she doesn't take them, and I think she does want to connect with her baby, but like you said, it just, you know, that baby is kind of the physical embodiment of all this trauma that she's lived. And I sometimes feel like when I'm holding the baby, like I sometimes feel his inner, you know, his energy, his vitality, like he almost gets a little panicked in like before he, you know, when I change his diaper, or but I'm able to sort of like calm this before it turns into something. And I worry that his parents maybe are having some sort of energy, you know, this nervous, you know, the dad always talks about like how he's not feeling like he can care for the baby, and I don't really know how to like help them with her, you know, with the confidence part and the just this deep connection, you know, fostering that relationship.
Well, I'm sure you're doing really just a lot of good to them, I'm sure. And for sure the baby's feeling the dad's insecurity. You know what I was thinking about the mother, if she's in this dual kind of state of being, just have two little water bottles and just drop some globules into one, some onto the other, and she can just be drinking water from both bottles. And doesn't have to be so picky, just as long as she drinks alternating one bottle, then now, the blue one now, the red one later, and just keep doing that. It'll serve her well. Yeah.
Mm-hmm.
Yeah, that's
for a bottle. How many globules would
it
you
doesn't
say?
really matter. It can just be 5-6 globules in a jar of water, and then each day just replenish it and put more. In homeopathy, it's not so much how much you put of it, but just the vital energy, the energetic value of the remedy. It'll reverberate in the water. So you could drink 100 globules, and it'll serve as one dose, and you can take one globule. It'll serve just as one dose as well. So it doesn't matter. Okay. Oh, it's hard. It's hard to.
No.
It's hard to hear that. Yeah.
Thanks.
And obviously, talking to the father about connecting to the baby's soul, and to talking to the baby about feeling secure and that everything will be all right. Just talking to the baby. I think that's never something that's recognized enough, that babies feel and know everything.
Totally. Yeah, he responds so quickly to just a calm presence, when I can see him sort of starting this panic thing, we just hold, I just hum or sing or just talk through, explaining what's happening. And yeah.
I personally haven't seen much postpartum depression, really, and I think it has to do with probably just home birth in itself and loving care. I just don't see that much depression. I think the famous baby blues, it is a thing, hormones, get a little bit funny, but the actual depression really has to do with trauma, I believe, some sort of trauma, some sort of feeling of being violated or losing control or being disrespected, something like that, even if it's subtle. Because people, a lot of hospital births that are considered normal or like uneventful, they call them uneventful birth. How could that ever be? In my eyes, are totally traumatic. When I was doing the little video about the baby evaluation, I went on the net to look up, if there were any interesting images I could use, or perhaps that would serve to nourish the video. I ended up watching some regular, normal baby evaluations, and I caught myself watching them like this, like a terror movie. The way I watch terror movies that I don't like to watch, I was going like this just because it looked awful. And that was just a normal newborn, awful evaluation. And that's what people consider normal. So I don't think it's any wonder that a lot of women do have postpartum depression. It's considered to be normal. What is the percentage of postpartum depression out there,
in the States, it might be 20%. It's high.
My goodness. You don't see that in nice home births. You just don't see it. I've never had a woman the way you describe, I have had women who had that before in other births, but then they come to me and they have a beautiful birth, they don't have it. But it's part of the violence and the trauma, for sure.
Yeah, I worked with a mom earlier this year, right, maybe 2 months into the COVID pandemic, and I was supposed to be present for her birth and supporting her, and then I ended up not being able to go. She had a very traumatic, I think, obstetrical violence. They performed the Christella maneuver, and she actually ended up having a heart attack while pushing. right after this, this pressure on the, yeah, that was another really difficult postpartum depression trauma case.
Wow. Oh my gosh.
Is that maneuver common in Brazil? In the
I think
hospital?
in hospitals that it might be. I think it's a resource for them. Yeah. I've never heard of it being like obsolete. Yeah.
It's interesting. I had never come across it while working in the States. Like, it's not done. I don't know, maybe Heather,
I'm not familiar with it. What is the Christine?
Right? Right.
It's leaning onto the woman's fundus, the uterine fundus, and pressing down
Okay.
on.
I have seen that done once. I cringed really bad.
Yeah, it's not common in the States. And I studied with a traditional midwife in the Andes in Peru, and she was telling me about these horror stories, like of indigenous women going to clinic and the obstetricians just doing this without even, no consent and all. And I just thought it was this horror story. And then here I am in Germany, and it's like, it's pretty common here.
Yeah, they do
and
it.
I'm surprised. I don't know.
It's pretty common in Argentina too, pitifully.
Say that again, Maria.
It is pretty common, Christeller is pretty common in Argentina too.
Yeah.
Pitifully.
Yeah. Mexico, anywhere that I know of where they feel that the baby's not coming down fast enough, they'll do a Christeller even before they will do a vacuum extractor or forceps. They're like, okay, let's just get baby push him out. And it's, it can provoke hemorrhage, and some women come out with a broken rib. It's
the time I saw it done, the doctor had already had a vacuum on the baby, and the baby had crowned once and then gone all the way back up. And so he thought maybe if he could do a deep high vacuum and that maneuver at the same time, he could get the baby down, and it didn't work. Mom had a C-section, and the baby came out just covered in bruises everywhere. It was kind of horrendous.
really.
This baby could not nurse for 3 weeks because she could not be handled.
Oh
And
my
the mother was great with pumping, and they were able to reestablish nursing later. So the baby still only had breast milk, but it was pretty horrendous.
Oh my God. Do you think the cord was short in that birth?
I think the baby was in a very strange position, and the mother's pelvic anatomy also was not ideal. She'd had a vaginal birth before, but that was also difficult. So I think that combined with a very strange position, I don't remember what position we decided the baby was in, because looking at the bruising patterns and where the mother was hurting, we were able to kind of determine that it was very strange. It was very strange.
Wow.
But the cord may have been involved as well.
Imagine the experience for that child. Wow.
So I remember now, if they discovered later that they think that the baby had a stroke, either during the labor or just before. I don't remember. So that may have been a contributing factor as well.
Really? Goodness. That's something. We've
No wonder we have so much violence in the world, yes?
Yes. What wild stories. Goodness. Heather, I've seen 3 children of yours already. Is that right?
I have 7.
You do?
I do.
Wow. I did see one who was holding the younger baby. Here's another.
Yep.
Wow, 7 children. You started early. You look so young.
Oh, thank you. I think I had my first when I was 21.
Wow. Congratulations. I love it. It's
So
not.
I have one more story for you. And this one's kind of a fun story since we've done some scary stories.
Yeah.
The midwife that I trained with, we do the metabolic testing where we poke the baby's heel, and we do that at home. And so as she was training us, and then later the state came and trained us some more, and they taught us all the same things, but whatever. we do a really good job with it. And she told us the story of how with one of her babies, she did it on her own baby because she knew she was the best at doing it of their midwifery group. And she thought, well, if I'm going to have this baby, my baby poked, I want to be the one to do it. So that way it's less traumatic. And as the baby, speaking of sad babies, as the baby got older, when her this was a daughter, I think she was 7 or 8, she came in one day and kind of had a funny look on her face and said, Mom, when I was a baby, how come you poked me and made me bleed? And so she explained to her, you know, what she did and why and what they were testing for. And she said, oh, okay, I just always wondered. And so now whenever we poke a baby, we make sure that we talk to them and we tell them what we're doing and what it's for. And it's funny that usually they don't even cry anymore after we tell them what it's for and what they're doing. And I just thought that was a really fun story as we were talking about talking to babies through things.
Very good story. Very good story. How come you did that, Mom? Wow.
I'm sorry, say again?
Yeah, how come you did that, Mom? I always wondered. It's fantastic. Yeah. We nobody really teaches people to take little babies into full-fledged consideration. You know, and we think that because the language is, they don't yet speak the language, they won't understand, but that's just beyond language. Another beautiful baby, Ricarda. That's lovely. Lovely child. Oh, beautiful. Hey, hi. So, would you like to speak about any other little topic? It's about 1 hour since we started. Should we wrap it up, or would you like to say something else, Vanya?
Yes, I'd like to ask something about rebozo. So in the video, you have you talk about the rebozo for engaging, like during labor. But I was wondering, can it be used by the end of the gestational age, like to kind of induce or kind of trigger labor? Because what we assist here in Portugal is, and especially now with COVID and everything, it's a lot of programmed medical inductions.
Mm-hmm.
So I wonder, could it be used, like, would it be a useful tool to?
It's useful for sure. It's useful. I always, hope, ideally that we don't hurry babies that are not ready to be born. But if the woman is in the hands of the system and they're going to be doing an induction or some other procedure, you can definitely use it, and it's useful. The baby's head rubbing against the cervix and all those different maneuvers will definitely have an effect. So you can do it. Yeah. Yeah. Well, it's quite an interesting time to be alive, I think. And I think it helps us all, I think really undoubtedly has brought most people I know into a very reflective state, this pandemic, because we are more connected to the people around us, because we don't have the freedom to run around the house, the city and here and there. A lot of distractions are taken away. So I think it's brought us to be very much more reflective and thoughtful and question everything, even question life, because anybody could get the COVID and anybody could die. I think it has brought this richness, and I have the feeling of deep appreciation that we're using our time well. I feel even this conversation, it was a little bit grueling, these stories, but the reflection is inevitably going to make us think of the uncomfortable things as well, and how to transit from that to just doing things better, more sensitively, how to help a woman who's depressed, how to help a baby that's not got a mother connected to him or her. We have a lot of work to do, and I think every single day, every single idea and like initiative or intuition that gets us connected to doing something will make a big difference, because it is the whole world in this state of being. So if everybody's like I try to imagine the planet, and every time somebody has like a realization and a connection, if there was a little light going off, I think the whole planet would be like lighting up in a very special way if we were able to look at the planet and ourselves from the eyes of an eagle. It would look really interesting. So my dears, we're going to be talking to each other hopefully next month again. Yes. And I'm going to run over to continue editing the next video. And I leave a big embrace to all of you, a big hug. And I'll be very happy to see you again. Okay.
Thank you so much, Naoli. Thanks, everyone.
Thank you very much. Goodbye.
Goodbye.
See you next time.
Bye, children.